Welcome back to Today's Health. Today we're talking about hip pain with orthopedic surgeon Dr. Scott Heithoff. Dr. Heithoff, before the break we talked about what the normal anatomy of the hip is and talked about arthritis a little bit. What are some of the symptoms of arthritis of the hip?
So when a person is experiencing hip arthritis, of course, usually the first symptom is pain. And the pain is typically in the front of the hip in the groin area and radiates down the front of the thigh to the knee. Also, it can hurt on the side of the hip or even in the posterior aspect of the hip. Typically, the pain will not radiate all the way down the leg, but everyone's a little bit different. Now, also, people will complain of inability to do certain things. Like people with hip arthritis will have difficulty getting shoes and socks on because they can't bend down far enough to do that. Also, clipping their toenails is quite a struggle for them. And then what frequently happens is other people will comment that they're limping. They might not even realize it themselves, but their family and friends will say that they're limping all the time. So that sometimes they come in just with the complaint of limping and they want to find out why.
Now, some people tend to stay at home and think, well, you know, it's just some normal aches and pains. I can just deal with it. At what point should somebody with hip pain really go to their physician?
You know, that's a real good question because people feel that they don't want to waste their doctor's time by coming in or waste their time by coming in, but it's important to find out what exactly is bothering you. So if someone is experiencing pain in the hip region, having limping, or having difficulty doing their daily activities, it's a good idea to get that checked out. Now, it may not be anything serious, but until your doctor checks that out, you just don't know.
So when you come in for hip pain, what type of testing will be done? How would you diagnose what the cause is?
Sure. So when a patient comes in complaining of pain in the hip, the first thing that we're going to do is we're going to take a history from them, meaning that we're going to ask them questions about where the pain is, where the pain goes, how long have they had it, what makes it better, what makes it worse. And I always tell patients not to leave out any detail, even if they think it's insignificant. Sometimes even the smallest details kind of help us zero in on what's going on. Then we'll do a physical exam, meaning that I'll examine the hip, do a range of motion, check the hip for instability and things like that. And then we'll typically get an x-ray. And an x-ray is usually the best way to diagnose any problems with the hip. Now, if there's trouble seeing things on an x-ray, we may even get further testing such as a CT scan or an MRI scan.
So once all of this has taken place and there's been a diagnosis of arthritis of the hip, what are the treatment options that are available?
Well, it depends on how bad the arthritis is, but generally we like to do what we call conservative treatment, meaning that we want to do some things that are simple to do that can help alleviate pain. And some of those include medications, physical therapy, sometimes injections, and depending again on the level of arthritis, all those are a possibility.
Now let's start with the non-surgical treatment options and medications. What type would you prescribe and how would it help?
So the main type of medications that we'll use for this are called non-steroidal anti-inflammatories, or NSAIDs is another name for them. And they're simply Motrin, Aleve, Advil, which are over-the-counter medications. There are some prescription medications, but essentially they're all the same. And they work very well. Now, some people cannot take them for various reasons. If they're already on a blood thinner or they have stomach issues, sometimes these medications cannot be used, but that would be a discussion you would have with the doctor at the time. Now, some people will also just take Tylenol, but the non-steroidals tend to work better for the arthritis.
Now, you also mentioned injections. What might the patient be experiencing as they're getting one of these injections?
Well, an injection for hip arthritis is not commonly done. It doesn't work as well as an injection for the knee, but sometimes we do them. And typically we inject kind of on the side of the hip if it's due to bursitis, or even on the side of a hip we can do in the office to help with arthritic pain. Now, sometimes if we're going to inject the hip joint, we'll need to use an x-ray machine to make sure that the injection gets in the right spot. But that's not a typical treatment for hip arthritis.
Okay. When you do get one of these injections, how does it work? How is it any different from the medication that you take orally?
So the medicine that we're injecting is typically a steroid, so it's similar to the anti-inflammatory pills that we give people. But the difference is with the steroid injection, the medicine's getting right to the spot where it needs to be, as opposed to taking a pill and it has to circulate through the bloodstream to get there. So it tends to be more effective because it is more localized treatment.
Now, do you recommend physical therapy for arthritis of the hip?
Initially, yes, and a lot of people are kind of hesitant to try physical therapy because they think, well, my hip hurts when I move it, why would I want to go somewhere and have somebody move it more? But physical therapy is more than just moving your hip around. They will do treatments such as massage or heat and cold therapy to help decrease the pain and inflammation. And strengthening the muscles and increasing the range of motion of the hip can significantly decrease the pain. And it tends to be a very good initial treatment for hip arthritis.
So physical therapy really does help to reduce the pain and to increase the mobility of the joint.
It does, and that being said, sometimes if the arthritis is too much, our physical therapy may not be as effective. But initially, if someone is just coming in and they have some arthritis but not a lot, and they're having some difficulty, physical therapy is quite effective.
Doctor, this is great information. It's time for another break. We'll continue in a moment.